Shannon, I will pass it over to you to make introductions, and if you want to introduce your team and residents as well.
So I'm the coordinator for the general surgery residency program, and I just kind of want to introduce our team. So we have different levels of experience here. We have Javier Benitez, who's new to our team. And then we have Melanie Bobbs, who is going to graduate this year and is applying to fellowships. We have, let's see, Chris Olson and Sameen and Mary, who are all third years, and CJ Riley, who is a fourth year. And they're all MDs. And I was going to ask Chris to kind of explain the path of how you go from being, a high school student to being a surgery resident.
Sure. I'm happy to do that, Shannon. So from the path of sitting where you are in high school to getting to kind of where we are now, in general, I'll kind of paint a picture going to medical school, and then I'll kind of change it over for surgery. So in general, you graduate high school and you go to college, and you pick something that you enjoy, that you're passionate about, and do well in that. And, with the appropriate prerequisites and test scores and all that stuff, you can apply to go to medical school. So 4 years college, 4 years of medical school. And then at the end of medical school, you do what's called your residency. And so while you come out of medical school, technically as a doctor, you're kind of like, you're a pretty new green doctor. So you need to kind of hone your skills and hone your specialty. And that's where you have people that go into pediatrics, or people that go into surgery or internal medicine or any of these different specialties. That's the residency part. And then residency lasts anywhere from 3 to 7 years, I guess, is what neurosurgery is at right now. And once you complete residency, you take your boards, and then you are an independently practicing autonomous doctor in that field. You're a surgeon, you're a pediatrician, you're an internal medicine doctor. What some people will then do afterwards, and that's what Melanie is in the process of doing right now, is go on to further subspecialize and that's called a fellowship. And so that puts you into an extra level of training and expertise. So that's kind of the overview and the pathway there.
Thank you for that. And I'll take it as someone who doesn't know much about residencies or fellowship, although one of my colleagues went to do her fellowship. I definitely am coming as a novice, and so hopefully my questions will help the students that Max works with as well. So I kind of just want to, let's have a question for Javier, since he's fresh in the residency. Will you tell us a little bit about your background and what kind of led you to your first year with the program?
Sure, no problem. So I was born in the United States, but I grew up in Mexico in a border town in Ciudad Juarez. I lived there until I was 17, and then a terrible drug cartel war started down where I used to live, so we had to move back to the United States. Came into the United States not speaking a word of English, so high school for me was really, really hard, even harder than medical school, I'll say. But after being able to tackle down the language barrier a little bit, I decided I wanted to be a chef. Nothing related to medicine at all. My dad told me I was crazy, so I went into college, not really knowing what to do. I really liked science courses, so I always did well in those. And medicine started to make sense to me. My dad is a doctor in Mexico. He still practices. And he will work from 7 a.m. to 9 p.m. And I never saw the guy complain at all. So I thought there was really something special about medicine. And while I was in college, I started shadowing, which means following a doctor and learning a little bit more about what really takes to become a doctor, what really is to listen to your patients and care for them, not only cure, but mostly care for the patients. And that's when I really fell in love with medicine and the differences we can make in people. And I went to medical school at A&M in College Station, Texas. And now, like Chris said, I'm one of the green new incoming intern doctors at Dell Medical Hospital. And it's been great. I really like it. I chose surgery because I always like to do things with my hands. I guess that's why I wanted to be a chef. But I always like to be able to work with my hands, to be able to be on my feet all day, be able to help patients right in the spot, you know, be able to go in surgery, come out, and 2 hours later, maybe change a patient's life. And that's one of the main reasons I chose this pathway.
Thank you. And so between Mr. Whaley and myself, we're going to ask questions. So feel free. I don't want to completely take over the show here. But I do have another question, and this is really to whoever wants to answer. And this is something we asked asked a third-year medical student. And this really hopefully can speak to the students that are still unsure if they want to go into this career pathway or not. But why did you decide to become a doctor? And that's really to whoever wants to answer that question.
I can answer that question. I wanted to be a doctor. I didn't really have a whole. I didn't have any doctors in my family, and didn't have a lot of exposure to it. My mom is a nurse, so I had that aspect of perspective. And when I was about to start college, I got a job as a EKG tech in a hospital, and I worked that job all through college. And as I was deciding kind of what I wanted to do, I knew I liked the human body, and I knew I had interest in science, and I wanted to make the most difference that I could. And at the time, I really wasn't sure. And to be honest, I was very intimidated by the idea of going to medical school. And I say that as somebody that always did very well in school, did very well in high school, because I worked hard, not because I was inherently smart or anyways. I was not, I never thought of myself as gifted or a genius. I knew how to put in work. But I was intimidated about going to medical school because I was scared to fail. I think you hear about medical school and you think about people tell you how hard it is to get in, and then you have to get through medical school and you have to do the MCAT and all these tests. And it's not that I didn't think it would be something I would want to do. It's that I was nervous that I would fail on the way to get there. And when I was a young freshman in college, trying to decide what I wanted to do after being, valedictorian of my high school, I was very, very nervous to let myself down, let my family down. And I almost did not go into medicine for that reason. And I only say that because I think that a lot of students in younger and high school can fall into that trap of you think that you can't do it, or you tell yourself you can't do it because you hear all the stories ahead of you and you think, well, why me? I'm not that smart. Or and it's just 100% not that. You just have to put in the work, and it's a day-by-day thing. And you have to be okay with failing. You're going to do it, and everyone does. Every single person that's on this Zoom call has failed. And you just get up and you try again the next day, and you'll get there.
Melanie, if I could ask, did you, and anyone else, the part of the reason for your fear, did you not hear anyone's failure stories who actually made it into medical school or made it out of medical school?
No, yeah, I had not been exposed to that many honest discussions about what it takes to get there, and all you see. And I think when you're young, you see, I always saw residents in the hospital as like, oh my gosh, these are doctors, they're so smart, and they must have done this and that. And it's so funny to think about on the other side, because I look back as a medical student and now as a chief resident of like, wow, how did I get through all that? And it's just a matter of perspective, and it's a matter of having confidence in yourself. and knowing that everyone has had to overcome some obstacle to get to where they are.
Thank you. And there's so much I want to ask about just the navigating just that pressure of not wanting to fail and whatnot, but I do want to hear from our other guests. And I'm going to pose the same question. Why did you decide to become a doctor and pursue this career pathway? And we'll go to Mary Thornhill. You're at my bottom left corner.
Sure. So for me, similar to Javier and Melanie, what they've kind of mentioned already, but I went to high school in Colorado and kind of always thought about medicine, but wasn't sure. I don't have anyone in my family who's in the medical field at all, so I wasn't really exposed to it as far as like on a personal level. But I was always in sports. I played basketball and ended up getting a scholarship to Texas Tech to play basketball there, and was really exposed to, like, we had our team physician and different people around that piqued my interest in it from more of a sports medicine point of view initially. And I took my science classes, did all my prerequisites, and was nervous to really commit to it at first, but eventually decided that that's what I wanted to do. So the combination of the science aspect is something that attracted me to medicine, an area where I felt like I was constantly going to be challenged and needing to learn new things and not just be in a job, not that every job stays the same, but something that I felt like was ever changing and something I could be a part of in that change. And then I think on some level you have to be wanting to help people and make a difference in someone else's life. So for those reasons, I ended up applying and going to medical school.
Thank you very much. All right. Forgive me, is it Simon?
It's Samin. It's a hard one. Yes. Yeah.
All right, Samin, same question for you.
Yeah. Okay. Sorry, please excuse the background. I was driving home from work, but I pulled over. So I initially grew up in Tehran, in Iran, in the Middle East. My dad's Iranian, my mom's American. We lived there until I was 16 years old, kind of like everyone else here. I don't have any doctors in my family. My mom's a teacher and my dad's an engineer. And then we came to college, or we came to the United States when I was 16 because my family wanted me to be able to have, college experience in the United States. And in college, I initially studied chemistry because I loved chemistry. I think it's just fascinating and magic. And I thought that I was going to be doing pharmacology. But I started doing research after college, and I realized that I'm definitely a people person, and I hated being in a lab by myself, and I wanted to see what I was doing making an actual immediate difference. And I am not a patient person, so I did not want to be waiting years and years. And I didn't really know much about medicine. Kind of like people have mentioned, I was kind of daunted by the whole medical field. But I started getting a job, or I got a job as a tech in a hospital in the operating room, and I completely fell in love with it. And I realized this is what I wanted to do. And kind of like what Melanie was saying, from the time I decided I wanted to go into medicine to the time I actually got into med school was a long, hard road. And the only thing that's gotten me to where I am today is the fact that I just refuse to give up. So that MCAT, the test we have to take before we get into med school, I had to take 3 times. And the 3rd time I finally got a score that I was happy with. And I had to apply to med school twice. I had to apply to residency twice. And every time it was so frustrating, but I knew this is what I wanted to do. And if I were to give one advice to people, is to not give up. If it's really your dream, just be persistent and work hard, and you actually can make it happen.
Thanks, Samin. I'm taking notes on all of you guys. I know the video is recorded, but I'm just trying to catch everything, and I find it's quite powerful. I imagine it would be to students. It is to me. I think everybody puts pressure on themselves, or has a voice in their head telling them to give up, that it's too hard, or that you're not fit for it or something. So I appreciate you guys sharing your passions and how your interests eventually outweighed your fears. Could I ask a question real quick to Samin? I do want to go on. I want to take a long time, but you mentioned the tech job that is where you really kind of made your decision. And you said it was a long road. How long were you in that tech? What was the tech job, like real brief? How long were you in that? And what was it? What kind of 3 or so things came together for you in that?
So I was a tech for 4 years. Initially, I worked for a year and then I applied to med school. And kind of like I mentioned, I didn't get in the first time. So I continued to work as a tech, but during that time, I took some additional classes, additional science classes, got some more volunteer opportunities, found some new mentors. And so I just took that time to really improve my application. And the tech job itself was amazing. It really gave me skills that I'm using now. It was in the operating room, and it just happened that one of my friends was having this job, and they said, I think you'd really like it. And what we would do is we would run all the machinery that is used during the operating room, because in surgeries, there's so much going on and there's so much behind the scenes. So I would help set everything up in the morning. I would help run some of the machines like the cell saver and the balloon pump. I would help the anesthesiologist put lines in. For a while, I was doing SBD, which means you clean the instruments. So really everything that goes into doing surgery, I've been a part of, and I think that's really shaped my experience. And especially now as a surgery resident, it helps me remember how many people are working so hard to make every single surgery happen. And I'm really grateful and happy that I had that experience.
Cool, thank you.
All right, CJ Riley, I think it's Christopher, right?
Yeah, that's the government name.
You've been so patient, and I know you were traveling. Thank you so much for joining.
Yeah, no problem.
So why did you decide to go into this career path?
Yeah, so I have a path kind of similar to what a couple people have said. So in high school, I honestly didn't think about medicine at that point. I was playing sports at that time and actually got injured. And instead of going to one of the other schools for a basketball scholarship, I ended up taking an academic scholarship to the college I went to, which was Johns Hopkins. And I was initially interested in like the neurosciences, which is why I chose that university. And so going there and working with a lot of people there and with their Neuroscience Institute, it just gave me an insight into basic research as well as some clinical research, because I worked with like the neurology and neurosurgery departments there. And seeing that clinical side is what first piqued my interest into the medical field. It made me start thinking about doing something in healthcare or becoming a physician possibly. And so after graduating, I actually did a research job. I came back to Texas and was in Houston for a year where I did some bench research, which is the basic sciences. And kind of like Samin said, I didn't like kind of being away from people. It was a lot of just kind of me by myself waiting on cultures to grow or, certain experiments to finish. And I realized I liked a lot of the clinical aspects because it was more of a translational lab. And so we worked closely with the neurology department and neurosurgery department. So it was a mix of some basic science and clinical research. And I realized I liked the clinical side a lot more because I did have that interaction with the patients, with their families, and with the medicine side of taking care of people. And so that's when I decided to, pursue a career in medicine. And I applied to medical school that next year, ended up going to University of Texas at Houston for medical school. And I guess my interest in surgery came from just the rotating through. I'm one that likes to be pretty active and working with their hands. And so surgery just really appealed to me. A lot of the specialties that were procedural based was kind of my first deciding factor between what specialty I wanted to do. And so I picked surgery overall just because of the pace of it, the more immediate answers you get, and the more immediate impact you can have on patients. That's kind of where where my thoughts are on that.
Thank you. Will you share quickly what the rotations look like? Is that during the residency program that you're rotating and kind of shadowing these different doctors?
Yeah, so initially in medical school is where you start rotations. You have clinical years, and during your clinical years, you rotate through various specialties ranging from internal medicine, neurology, psychiatry, surgery. And, normally these are about 4 to 6 week or 4 to 8 week rotations. And it allows you a kind of snapshot into that specialty, into that field, to see if it's a fit for you and to see if it's something that does interest you. And so that's where your rotations start. Now, as a surgery resident, particularly general surgery, we also rotate through several surgical subspecialties, including cardiothoracic surgery, surgical oncology, vascular surgery, and trauma. And that allows you to kind of get exposure to those subspecialty fields within the surgery realm to see if you want to do those fellowships that was mentioned earlier.
And I guess Melanie can probably speak to this, but do most people apply for fellowships outside of the state? Do you stay local? Like, what does that process look like? Got to put $1 in the pot.
Fellowships or residencies? Sorry.
Oh, fellowships.
Yeah, so a lot of people end up applying for fellowships out of state because as I think with each step, there's not as many options for fellowships in the sense that they're a little bit more limited. That being said, some are more limited than others. So there's definitely fellowships that are a bit more competitive, so you have to apply more. It's similar to any sort of time where you're going to be applying to things. But for the majority of people, when you apply to a fellowship, you do end up applying out of state just to decide where best you think you're going to fit in. And a lot of people have limitations for geography. A lot of people have limitations based on their family as far as where they'll go, and that's kind of a personal thing. Did that answer your question?
Yes, thank you.
Mm-hmm.
I'm looking at Mr. Whaley in case he has a question.
Yeah, I mean, I thought we may have given enough description of a fellowship, but a lot of my students may not recognize what that means. I may not even know exactly. I had a little bit when I was in graduate school. I was in a fellowship for a couple of years, and so but that might look different in different cases, especially for your career direction. So
yeah, so a fellowship is so you do for our specific specialty, general surgery, your residency is 5 years usually. Some programs will do an added 2 years of research, so the residency 7 years, but it's 5 to 7 years. And at the end of your general surgery residency, you can go into practice. You can be a general surgeon, and general surgeons are very needed across the country, a lot more in more rural areas or underserved areas. But by and large, I feel like more larger tertiary care communities, academic centers are a lot more specialized. And so the different specialties you can go into after residency include surgical oncology, vascular surgery, trauma, which is what I'll be going into. There's colorectal, there's breast, there's a multitude, pediatric surgery. And so there's quite a few different pathways that you can go on to specialize after general surgery. I'd say the majority of people do end up doing a fellowship these days. However, there is still quite a number of people that go straight into practice.
Good. Thanks.
Mm-hmm.
So I have a question for those who share that they're athletes. I know there's a lot of high school students that are athletes. They may have scholarships ready for them. And I wonder if that has any inspiration to you going into this program now, just like being an athlete, knowing how severe injuries can be for both Mary and CJ. Did that have any influence in you joining the general residency program?
I actually drew a lot of correlation and similarities to my role being on a collegiate team to being part of a surgery residency program. And I found a lot of similarities as I went through my rotations, like they mentioned in medical school, to being a part of a surgical team. And I think that being an athlete or, a part of any kind of team teaches you a lot. And it's a lot of intangibles that you can take into any career, but surgery in particular, it's always just been easy for me to work within a team and be able to find my role and how I can help. So I think that was hugely important. I also think I learned a lot of discipline and a lot of self-motivation being an athlete. But I think you could get that from other things as well. But for me personally, I still see things to this day that I can take from playing basketball that I learned and that I use today.
Yeah, I would echo that. I have similar feelings and thoughts about it. One big thing, particularly in surgery, particularly in this program, I know being a part of that team and going through hardships and things like that, it's when you have a group of people that are going through it with you and you can be each other's support system on top of the support system you may have outside of that, it really helps to get through and to persevere through it. And so, because residency, it has its ups, its downs, its tough times, but just like when I was playing basketball, those rough practices or rough games we had, my teammates and were very it's kind of important in helping keep each other's morale and things like that. And I think that same can be said in medicine a lot. It's very team oriented, and that's how you give the patients the best care. You'll see a lot of multidisciplinary teams taking care of patients, which means teams involving medicine and surgery and a pulmonologist or an oncologist, which is a cancer doctor, and all these different specialties to come together to look at the patient as a whole and give them the best care. So that teamwork effort, as Mary mentioned, was kind of very relatable for me.
If I could just chime in on that last thing, but like seeing the value in the other teammates, I mean, you would have practiced that in the sports you played in high school, and so it's probably natural for you, and also you got a lot of reward from that, and so you still get that. You're going through it with someone, and that's kind of more rewarding perhaps than something that's not so challenging and you don't get to develop that same kind of morale.
Right, I have another question. So, and this is to whoever wants to answer. So as a high school student aspiring to go into the healthcare profession, what academic advice do you have in order to be best prepared for medical school?
I can start first and then someone can add on, but I think one of the things that is going to be most beneficial is just to develop good skills in time management and just work ethic in general. I would definitely not say that if you leave high school, and you don't have a good GPA or you didn't do well in this class, I would not let that affect you if you do end up wanting to pursue medical school. But high school really is a safe time to really start developing those skills that you're going to need in college, and especially in medical school, and then especially in residency, of how to prioritize your time, because it's going to become more and more limited as you go on in your path.
I completely agree with Melanie. I think the time management aspect is crucial. Underscoring the other things that we've all already heard though too. I mean, I think being able to bounce back and having that resilience when you get little setbacks along the way. I mean, every single person on this call has had them, right? And so being able to have the focus and say, look, this is my passion, this is my thing, this is what I want to do, and this is a bump in the road, and I'm not gonna let it knock me off this path. I'm gonna still go for it. I can think of numbers of occasions along the way where I've either had somebody tell me you can't do this, or it's not going to work, or a test or something where I'm like, what am I doing? And we're here now. Everybody has those experiences.
Yeah, I had a college advisor, and then one of the cardiologists that I work with, like, just straight up told me, he's like, you won't get into medical school. I'm like, watch me.
Yeah. My college advisor also said, don't even bother applying for MD, PhD programs. It's never going to happen. I was like, okay, go ahead, watch me.
But I think it's also important on that note, because medical school is hard, and you have to put in the work to get there. And then while you're there, you have to work hard. But I also think it's important, especially from a high school mindset, that you also have to be a kid. You have to have experiences, and you have to have fun, to do opportunities to do community service, do opportunities to travel and learn about the world, and learn about different communities and different perspectives, because that's all going to come into play in how human you are. Anyone can be trained to be a surgeon. It's technical skill, and it's learning how to make decisions regarding medical care. But when you really differentiate yourself as a true doctor, the ones that we aspire to be, you have to know how to talk to people, and how to have some empathy, and you're only going to get that by having experiences in life. And so you can't just go to high school and not play sports or not do music that you enjoy, the things that you enjoy doing, because that's what makes you the person that's going to be the doctor that you're going to be.
If I could say something with that, like, it made me think of Javier, and like, I think Simin, like your transition, at a pretty young age, like to a different country, different learning challenges. Like, I think that's kind of what Melanie was talking about. Like, that really makes you, well, Javier, you said that was harder even than med school. Is that right?
Yeah, for me it was just trying to learn a new language, try to fit in a social group, and I mean, thinking that just 10 miles away, all my friends were just having a blast was really killing me inside at the time.
Thank you.
One thing I would add to what Melanie said is you also don't need to rush. Like, some people go straight from high school to undergrad to med school. And some people take a couple of years off, and some people take 1 year off, some people take 4 years off. And I think the experiences that you gain working and not being in school, and like Melanie was saying, doing all those things that make you who you are also really important. So that would be also one advice I would give, is don't rush it. Don't feel like you're behind if you're taking time. That's sometimes a good thing.
Oh, that's really great advice. And that's coming from someone who you mentioned earlier that you can get impatient. So that's interesting. Now, Catherine, I see that it looks like we see you Thank you for joining us. And it looks like you're working right now. So do you want to share like where you're at and what you're doing?
Sure.
Here's my patient.
I'm taking care of Melanie's patient. He's doing great. I am in the hospital right now. So my name's Catherine. I'm one of the PGY2s, and part of our rotations as a second year resident is we work in our surgical ICU. And so as part of that responsibility, at least once a week, I take call, which means I'm stay in the hospital for 24 hours, and I'm in charge of all the ICU patients. And then kind of on top of that, about every other week, I will also double up and take trauma call as well. So any new trauma patients that come in or any trauma patients that we're currently taking care of, I'm also watching over, you know, overnight and while other people are at home and before the day team comes back on.
What does PGY2 stand for?
Sorry, it means I'm a second year resident. It's postgraduate year 2.
Postgraduate year 2. Okay.
I don't know if this is going to take us in a different direction, but I thought I'd ask like about COVID-19 impact in like residency for residents like yourself. In my own life, like it seems like in some ways there's been more margin in my life than previously, and then in other ways it seems like everything takes longer to do, just like personal everyday things. And so I imagine people like yourselves who are really immersed in your job, in your it's kind of your whole life. How on earth do you function in the workplace, and then also just outside of that, your personal interactions with people?
So COVID's made everything interesting. I probably won't dive too much into that rabbit hole, but it has certainly made it interesting in the hospital, and it's made it interesting for our lives outside of the hospital. As kind of part of this whole team structure that, you know, Mary and CJ have talked about, and being part of a team, when things started getting really kind of crazy and ramping up, we actually all came together and tried to sort of minimize our time in the hospital so we could sort of minimize exposures. And that was all of us, you know, figuring out what's sort of the minimum staff that we need there to take care of people so that we can allow other people to be out in case people got sick and that sort of thing. So it's definitely, I mean, it's made it tough, but you know, we're all a product of our previous life experiences, and you know, all those same things with, you know, resilience and time management. I mean, it all still plays in. It kind of just feels like another layer added onto it, I guess.
I think that's also what it goes to the point of, is that obviously COVID-19 is it has changed all of our lives, both inside and outside the hospital. But at the end of the day, you take a Hippocratic oath that you are going to take care of patients without harm, and that means that we show up every day and we go to and we work and we take care of patients. We try, at least for me, I can't speak for my colleagues, but everything else is white noise. I come to the hospital to do my best to take care of patients, and everything else that I have to do for X and Y reasons and PPE, I try not to let it affect me too much in the sense that I'm there to do one job. And when it comes to outside the hospital, both, I think, regardless of COVID-19 or not, I think, as I had mentioned before, the farther you get along in this path, the more limited time you have. And I think when that happens, you kind of naturally shed a lot of the, I guess, the weight in sense. And so your priorities come forefront of what's really important and what deserves your time. And in almost in a selfish way, but not in a negative connotation. You really have to choose your time and spend the time with the people that build you up and make you feel like who you are, and do the things that really fill your cup up, because that is your time and you're human, and you need to be able to come to work being the best person you can be, and that means sometimes you have to turn work off.
I think another thing that I don't know if it's been, I had to hop on the call kind of a little late. I don't know if it's been mentioned, but being able to adapt to change and being flexible has been kind of a huge element, at least kind of in my experience with the pandemic so far, and kind of what we've been talking about of it kind of becoming this almost overwhelming system of trying to make sure that we're taking care of patients and making sure everybody is getting the help that they need. We're having to kind of change what would be the norms for us in our work schedules, and kind of what, you know, would have been our expectations had we been doing the same job a year ago. So I think maybe something on top of all the resilience everyone has been talking about, which is incredibly important, also having an element of like flexibility and ability to kind of adjust to change has been a big thing.
Ellie, I really like what you said about filling your cup up and just really taking care of yourself outside of work so you can be your best self at work. But which leads me to a question. What do you all do on your bad days and you have to go and serve and have, you know, a great face on for your patients who are also, you know, in a really rough spot? What do y'all do?
I can go first. I'm kind of an introvert, and I am a athlete and I run. And so the first thing I need to do is kind of release all of that energy from whether it's going to the gym or going for a run. Usually I need to do something solo instead of with other people. And that's as I mentioned before, that's one of the great things about having a job where your time is limited, because you really learn those things about yourself that maybe you didn't know before. Maybe hanging out with a bunch of people after a long day isn't really what's going to make you feel better. And then I also think it's really important that you have a good support system, and that's going to be important no matter what stage you're at in this, whether it's medical school, residency, and beyond. And it can be, you know, your chosen friends or your chosen family or your given family. It can be mentors. I know I'm very close with one of my mentors, and I have a deal with him that anytime that I'm angry, I walk into his office and I get to say whatever I want. And I think that it's important that you have those people in your life. CJ Riley has a really cute child, so he's cheating, and so does Samin.
I think along the same lines is that our residency is fairly small, but having people that understand what you're going through and being able, I know for me, like venting to a co-resident often helps a lot because I know they understand and get it and can completely relate. But just like Melanie said, having a good support system outside too is hugely important. And then if I'm, you know, like in the flow of work and it's a really hard day, I usually just try to focus on the patient in front of me because that person needs me or my co-residents or whoever it is, and they're probably having a worse day than I am. So that's usually how I try to switch my mentality if I'm actually at work.
Yeah, I agree that, you know, reaching out to people who are kind of going through the same thing you are. So Chris and Mary and Charlie, who's our other third year, we're we all have, we text each other all the time. We kind of vent to each other. We're each other's support system. And that's really nice to have someone who's going through that same thing with you. But then on the other hand, coming home to, a baby who doesn't really care what kind of day you had, and coming home to the rest of your family, it's also nice to be able to shut off that part of your life. And so I think that's where balance comes in. And when you're at work, you have to be really, really focused on work. And like everyone was saying, the patients who really need you, but then it's really important to be able to turn that off and go to your family and go run, or just sleep, or do other things that kind of fill your cup up.
Yeah, I echo and agree with them. I mean, having each other at work, those who are going through the same things. But I think it's also important to be able to kind of turn that side off, and that's how you can kind of get through some things. Talking to somebody that isn't in medicine, so that you can just just put the topic away. Because a lot of times when you're talking to each other, or I'm talking to my co-residents, it'll turn back into medicine, or back about a patient or another patient, and sometimes you just need to step away and kind of reset and reboot. And so I think being able to have that other interests or outside interests from healthcare and medicine can really help with that. Don't get me wrong, we all love medicine, we love what we do, but I think there is something to say about having something outside of it to, like I said, reboot and reset yourself when you need to.
I think these are, just kind of bringing it back around for folks that are in high school right now and looking and going to college. I mean, I think these are also good points to keep in mind when midterms are coming around and finals are coming around, or you've got to study for a long period of time or whatnot, and then you just have to say, look, I need to take a step back and do whatever I need to do to fill my cup. I mean, these are all common themes that the reason that we are saying this right now is these are all practices we learned early on, kind of when we were in their shoes or shortly after.
I do want to say, kind of as a different subject, only because bringing it up with CJ and Samin. As a woman, I was told multiple times by multiple people, both in college and in medical school, that my ability to be a mother would be inhibited by going into medicine, and especially going into surgery. And it's a tragedy that's even talked about in 2020. But I just want to be very clear and very honest in saying that, a lot of our family structures are changing, of what it looks like to be parents, and what it looks like to be a household, and what it looks like to have partners. But you can absolutely 100% be the parent you want to be, and especially women that are often held to double standards. You can be the mother that you want to be. It's all possible. It's just at some point somewhere in your life, and that's with any job, some things are going to give at certain times, and it's no different in medicine. And you can 100% be the parent you want to be as a surgeon and as any other physician. And I think that's a really good point for young women to understand and to know.
I would say, just kind of touching on that, especially early on, I would say a lot of things that, particularly in high school and as you coming up and coming through, that you hear, you want to take with a grain of salt, especially if you're hearing it from someone that isn't in the medical field. Because I heard a lot of rumors about, if you go into medicine, like Melanie said, can't have a family or this or that, or especially if you want to do surgery, you have to wait until everything's done before you can try to do anything successfully, or else it's just going to fail. I just want to say, don't let all of that discourage you. Just because you will hear some rumors and some things that will and can discourage you. But hi, I say just experience it yourself, and, you know, talk to someone in the field to get a true view from that perspective. And even within the field, you have people that cater their career that cater their careers and their practices to their priorities. And so you know, not every surgeon is always at the hospital. You know, the hours per week vary based on what's important to them. And so you can, even amongst the specialties or the historically high hour specialties, like, you can find things that cater to what you want in life and what's important to you. And so don't let those rumors or things that are kind of circulating around discourage you from that.
My question is, in just a few sentences, what would you tell your senior self? So if you could go back in time to when you were starting your senior year of high school, what do you tell yourself? And yeah, can you remember that question?
Well, I mean, if we are over, if someone has to jump off, that's fine. But if y'all want to answer,
That's fine. I'm happy to stay longer as well, but I
does
didn't
anyone want to answer that?
I would tell him, you can do it.
I would tell myself to not be so hard on myself, and to tell myself that you can do it.
I would tell myself that it's just going to get better and better from here.
I will tell myself that that dream is not too crazy, that if you're passionate, you can do it, and eat more ice cream.
Love it.
I would, you know, tell myself that, you know, to keep being persistent, don't rush, like Sameen mentioned. There isn't a timeline that's set in stone in order to do it. And I'll probably tell myself to eat less ice cream. Had a problem with.
Yeah, same as Sameen. I would tell myself that it just keeps getting better and to be patient.
And have fun. Life is supposed to be fun, and with the people that you love, spend time with them.
Thank y'all. Now, Chris Olson, to wrap us up, I know you wanted to share a little bit about the MD PhD pathway.
Yeah, I just wanted to give a brief thing for this. So when I was in high school, I also didn't have parents that were doctors, and I kind of figured out through health occupations classes and stuff that I think a doctor is what I want to be. But I love chemistry and stuff in high school and the experiments. And so when I finished high school, I found at the local university just some professor that would let me basically kind of bum around in his lab and try and figure out some experiments. And he gave me a little, I had no idea what I was doing. But what that triggered in my mind was, well, actually, it turns out I really like science too, and asking these questions and doing basic research. And that's kind of when I started to figure out about my first year in college that there was actually a track where you could do both your MD, both your medical degree and a PhD as well. And I will put it out there, it's a long time in that it kind of doubles the length of medical school. But there's a number of advantages to it.
We call these people nuts.
Yeah, it's true. It's true.
I'm just kidding.
That's it might be a little bit crazy, but when you get through, if you really, really, really love research, and I know there's going to be someone out there that's like, I want to be a scientist, and I think I might be a doctor, or I want to be a doctor and I think I want to be a scientist too. I mean, that is exactly what this track is for. And it lets you go through, do all of your medical training, do all of that rigorous research training. You get both degrees in the end. And to offset that amount of time that it took kind of out of your 20s, they pay for the entire medical school. So because of that, I ended up basically coming out of medical school with almost no debt, which is, I wouldn't say that's a reason to do it, but if you are leaning towards liking research, it certainly is appealing.
It would be nice to go round robin one more time, and I want you to say your name and then say, I'm a third year, medical student, or, whatever it may be.
Hey guys, my name is Javier Benitez. I'm in my first year of general surgery residency, and I want to be a really good surgeon.
I'm Melanie Bobbs. I am a 5th year general surgery resident and currently applying to fellowships in trauma surgery.
I'll go. I'm Sameen Road. I'm a 3rd year surgery resident and I want to be a trauma surgeon.
I'm CJ Riley. I'm a 4th year surgery resident and I want to be a vascular surgeon.
I'm Mary Thornhill. I'm a 3rd year general surgery resident and I want to be a trauma surgeon.
I'm Catherine McElhaney. I'm at work. I'm a 2nd year general surgery resident, and I'm going to be a really good surgeon.
I'm Chris Olson. I'm a 3rd year surgery resident, and I'm going to battle cancer to the end of my days as a surgical oncologist.